Minister, the withdrawal of the Versatis patches from the drug purchase scheme and the medical card has been a debacle. And somebody should put up their hand and say they've got it very, very, very wrong. And those who are benefiting from the patches, and they run into tens of thousands, are being denied this medication that gives them relief. And I know the HSE have said that it's based on clinical grounds. But for most people listening in here or on radio or television, and when they hear people, it's they would think it's a monetary decision. And I've had a number of people contacted our office in relation to this matter, and to say they're distraught is an underestimate. And they're going through life a condition that that's chosen them. They haven't chosen the condition of chronic pain or pneumatic pain, and the patches give them some sort of relief. But now, because of the decision by the HSE, it puts them out of the reach of these patches. So I think, Minister, in the short term, the HSE might save money, but in the long term, it will cost the HSE a lot of more money and hardship, particularly to the people that are benefiting. Now, I know you made a remark this morning about, that the radio station shouldn't make decisions. Now, I think that's quite a flippant remark. I don't know if you meant anything by it. But I know clinicians make these decisions, but I'm asking now the HSE to withdraw and repeal this decision.
Thank you, Minister.
To, at the outset, thank the deputies for raising what is an important issue, and an issue which I recognise is causing significant concern for a number of people, and therefore I very much welcome the opportunity to put some facts on the record of the House, and suppose to try and provide some guidance and information into how best patients might be able to proceed in relation to this important issue for them. I am very conscious of the impact of changes on individual patients, and I'd like to use this opportunity this evening in the Dáil to set out the background to the decisions made by the HSE's Medicines Management Programme, and then the process by which patients can apply for continued access to the patches. As I've said, I am very concerned that I've heard many patients worried and upset on this matter, and it's important that they hear this evening how they can have their case reviewed. Lidocaine 5% medicated plasters are licensed in this country to treat neuropathic pain from previous shingle infection or post-herpetic neuralgia (PHN) in adults. They have been reimbursed for those purposes in the Community Drug Scheme since 2010. When the patch was first introduced, its projected budget impact was low because of the very specific licensed indication. It was clearly therefore a clinical cause of concern when the reimbursement cost increased from €9.4 million in 2012 to over €30 million in 2016, mostly from unlicensed use of the patch. So when you have clinicians in a medicines management programme seeing that a patch that was expected to be used for a small cohort of patients is now being used for a very large cohort of patients, and in many cases for indications that it was never meant to be used, it is important and appropriate that clinicians in the HSE would review this. So in 2016, the HSE's Medicines Management Programme reviewed the use of the project, and the National Centre for Pharmacoeconomics estimated that in this country only 5 to 10% of the prescribing of the patch was actually being used for the condition it was licensed for. In light of this clinical review, the HSE introduced a new reimbursement system for lidocaine patches from the 1st of September last year, as has been done in this country for other medication, including Entresto, which is a heart failure drug. This process supports its appropriate use and ensures that post-shingles patients continue to receive this treatment. So I've heard accusations in this House earlier, which led to my response about this being a government decision. It's not a government decision. This was a clinical decision made within the HSE. And under this new protocol, all patients who were receiving antivirals for shingles were automatically registered on the HSE's PCRS system. These patients continue to receive this treatment under the community scheme. However, since the 1st of December, non-shingle patients no longer automatically, and automatically being the important word, no longer automatically receive this item. The HSE advised GPs and pharmacies in August of last year of these changes and of treatment alternatives for non-shingle patients. But I want to absolutely stress on the record of this House that it is possible for non-shingle patients to be approved for the patch through the community schemes. The patient's GP should apply to the Medicines Management Programme through the online system, and that medicines programme will review the application and inform the GP of its decision. And this is not just some sort of abstract thing I'm talking about. I'm informed that as of today, over 450 such applications from GPs have been approved. So that's 450 people whose GPs have applied and said, my patient doesn't have post-shingles but does have a condition and they need this patch. In addition, where a GP's application is rejected, it can be appealed. And actually, I have to update the figures. I'm now informed as of today over 220 appeals have been granted, and that's over 61% of appeals being accepted on clinical grounds. So that brings us to well over 600, nearly 700 patients who are receiving these patches, despite the fact that it's beyond the shingles indication. So I want to be really careful and clear here. Whilst this is a clinical decision, and a clinical decision for the HSE and its medical experts, there is a process in place for appeals. I want to see that process applying the absolute maximum compassion, and I've conveyed that in the clearest possible terms to the HSE. This needs to be done in a compassionate way, where if your GP highlights to the HSE's medicines management programme that you need these patches, that application and appeal would be looked upon compassionately. And I'm encouraged to see today the successful rate of appeals increasing from 50% in recent days to 61%.
Minister, it seems all so bureaucratic, you know, and it seems like compassion gets lost in bureaucracy. I mean, I know there's an appeals decision, an appeals mechanism, and a case-per-case mechanism as well. But surely you're putting people through unnecessary kind of suffering and bureaucracy when they go to their GP. And as you know, 1 in 8 people at the moment suffer from chronic pain. And you think of the amount of opiates that are using, or people have been used for chronic pain. You know, Versatis patches are less harmful in the short term and the long term for them particular patients. And I think I was listening to Joe Duffy on Friday, and one of the contributors actually said a really, you know, a line that kind of actually said it all. She said, "Look, we're real people with real evidence, with real pain." And I think, you know, the HSE should listen to people, rather than make a bureaucratic decision that can actually have a huge impact on the people that actually can benefit.
Thank you. Minister.
Well, look, I want to pick up where you left off. It's really important that the process isn't bureaucratic, and that's why the appeals process is online. It's done through your GP. They turn around the application very quickly, and hundreds upon hundreds of people are now accessing this patch above and beyond the post-shingles indication as a result of the appeals process. But you're right, it absolutely needs to be compassionate. I want to see it be compassionate. I'm encouraged by the fact that the number of successful appeals has significantly increased from about 50% in recent days to over 60% today. But look, this is not like, and people can try if they wish for political reasons to describe this as the previous issues in the health service. It's not comparable at all to that, because this is a clinical decision. This is medication, and it's medication that, if used incorrectly or if used for long-term use, can have adverse consequences. So it is important that the medical experts in the HSE have a role in this. These are doctors as well. But I do want to say, I really hope that the answer I gave here earlier in this House did not give anyone the wrong impression. I'm very concerned about the worry and the upset that I've heard from patients. I want them to know that I'm listening, and I want them to receive the compassion and the treatment that they need. My point was, though, that there is an application and an appeals process in place that their doctors can use in order to gain access for their patients. And almost 700 patients in this country have gained access to these patches as a result of that process. So I certainly did not mean to, nor ever would I be, dismissive of people finding themselves feeling that they've no option other than to call a radio programme, which is rightly highlighting an issue that is concerning people. But I've always been clear that when it comes to wanting to see our citizens access medication, I want them to be able to do that through engaging with their doctor, and in this case their doctor engaging with the medicines management programme. So we are listening, I am listening, and I believe those patients who need these patches can and must continue to receive them through the process that's been put in place. Doctors can make a case to the medical experts on behalf of their patients. These applications are being turned around quickly, and as I've said, the success rate for these applications is significantly increasing because of the compassionate approach being taken. And I want to see the HSE continue to take the compassionate approach, that anyone who needs these patches on the advice of their GP should be able to receive them.
Thank you very much.